Typically, when you're traveling, you have a lot on your mind. You have to get your tickets, you have to pack your bags, you have to make arrangements at work, you have the kids. So it's very stressful to travel. Travel clinics are specialized in travel. Patients, particularly if they're traveling to developing countries, it's very important that they actually, we think that they see a travel clinic because you're in a clinic where there is the expertise in travel. For example, at Henry Ford, our travel clinic, that's all we do. Our staff does this full time. We're trained in travel. We can tailor a trip based on the country, based on the region in the country, even based on the city. Certain illnesses might be found in one region of the country and not found in another. We also have the vaccines that most clinics are not going to be able to stock. So vaccinations that people should be considering and possibly getting when they travel include vaccines against hepatitis A, hepatitis B. Typhoid is a big issue in developing countries. Certain countries require, and you should get a yellow fever vaccine. And also you should have adequate protection against malaria, which is usually a pill that we prescribe for patients. Now, in addition to this, there are some routine vaccinations that you can get from your primary care physician, such as a flu shot, tetanus shot, and maybe a pneumonia vaccine. Our mantra in traveling is cook it, peel it, or forget it. It's very important that foods are served steaming, that they're well cooked when you eat them, and that any fruits you peel yourself, and liquids should be served in sealed containers. Any water, any bottled water, for example, should be in a sealed container, and also any milk products should be pasteurized. 2 practical tips when traveling on vacation. Number 1, make sure that if you're going to a climate where there's a lot of sun, that you are taking your sunscreen with you. You want to use sunscreen with an SPF 30 or greater and use a lot of it. And if you're traveling to a country where mosquitoes and other insects might be an issue, it's very important that you use an insect repellent. We recommend repellents containing 30% DEET. Some common medications that you can get over the counter that we recommend patients take on vacation, for example, would be some pain medication, maybe some acetaminophen, an antihistamine, certainly some anti-diarrheal medication. We want you to go prepared, we want you to plan in advance, we want you to have a great vacation and come back healthy.